It's Hand Therapy Week, a time for therapists to raise awareness about the benefits of hand therapy and to educate the public. I'm joined by Craig Joachimowski, a hand therapist in our area with Tidewater. Good afternoon and welcome.
Thank you very much.
So it's good to have you guys back. You were here last year. Talk to us about hand therapy and just how it benefits your patients.
Well, hand therapy is a specialized treatment that's provided by either a physical therapist or an occupational therapist that has an advanced designation,
Okay.
is what we call the certified hand therapist. There's a certain amount of requirements that we have to fulfill in order to have that designation. And it recognizes a professional in the therapy world as somebody that has a advanced understanding of the function and the anatomy of the hand and actually the entire upper extremity.
Okay.
So when we encounter someone that has either had an injury or they've had surgery to repair fractures, tendons, or nerves, physicians trust that we have that knowledge to go ahead and take care of that individual and rehabilitate their arm so that they can get back to full function.
And when we were talking a bit ago, you were saying that some doctors can be very particular because if you don't know exactly what you're doing in terms of the certification, then you can sometimes do more damage.
Oh, absolutely. Having an understanding of what goes on in surgery and actually having a very good rapport with that particular surgeon gives you an idea of really how far and how quickly we can push a patient or maybe not push a patient when it's appropriate so that they get the ultimate so that we can put them back into full function.
Full life. Now, for someone who's maybe watching and they're saying, well, my doctor I'm still having some issues or I don't feel like I'm 100% yet. Is it the kind of thing where your patients are referred to you, or can people call the office and say, I'd like a consultation maybe?
Typically, it requires a physician's referral, although some people are more than welcome to give us a call. And that's just part of the service that we provide, is that we'll talk to people on the phone, maybe direct them in the right direction where they need to do at that point, sure.
And you've been doing this now for about 5 years with the certification, but you have been in this industry for many years, you were saying.
Yes, I have 30 plus years of experience as a physical therapist, and many of those years I've worked with people with hand injuries. I just, in the last 5 years, got my hand certification. So I've seen a lot of things over the past 30 years that helps me in terms of developing treatment plans for people.
And again, you were saying, just to emphasize, it's hand therapist, but it's shoulder, the girth, the girdle, the arm.
Exactly. It's basically from your shoulder to the tip of your fingertips is what we're actually, one of the things that we have to do to become a certified hand therapist is take a very rigorous examination. And that examination is going to include everything from the shoulder to the fingertips. Wow,
so you get all kinds of patients coming in, like you said, after surgery or just some major trauma to that.
It could be from trauma, surgery, simple things like stepping down a step and falling and breaking the wrist or their elbow.
All right, now I imagine it's a joy when you see that you get people back to using. I mean, it's important to be able to use your hand and your shoulder,
Absolutely.
your arm.
We manipulate our world with our hands, and it's, even if it's not your dominant hand, it's a two-handed world out there, and it really impairs people's function tremendously when they have a hand injury. So it is very, very it's great to see people regain that function and be able to do things, just the simple things in life. Button their shirt,
comb their hair, raise their arm a little bit.
Exactly right.
Put glasses on even.
Little things like that, we don't realize how big of a deal they are until you can't do them.
All right, well, thank you so much for sharing with us this Hand Therapy Week and just giving us a glimpse into what really goes on sometimes as far as rehabilitation of those extremities. We appreciate you.
My pleasure.
All right.